He may even identify himself with it and believe that he is what he appears to be.
Welcome to the NCE Study Guide. I created this study guide using ChatGPT and Notebook LM. So think of these modules as AI-powered audio flashcards. Each one of these 20 modules contains 10 mock questions, representing the kind of questions that you might encounter on the National Counseling exam. I created this primarily for myself, and I decided to make these available to anyone else who might benefit from this kind of study aid. But please note, while I have done my best to ensure that these modules align with NCE content, I encourage you to cross-reference them with trusted study guides and resources for the most accurate preparation. These modules are not affiliated with or endorsed by the NBCC or any official licensing board. So, with no further ado, here are your AI study buddies from Notebook LM. Enjoy.
All right, welcome to our deep dive, everyone. Getting ready for the NCE, and today we're tackling Module 1, specifically questions 1 through 10. So think of this like your AI-powered study guide. One of 20 modules, by the way, designed to help you, break down all these complex counseling concepts and really just ace that exam, right?
Yeah, exactly. We're going beyond just the surface to really unpack these core ideas, which are going to help you not only pass the NCE, but also form, like, the foundation for your counseling practice.
Okay, so let's dive into question 1. Which counseling theory emphasizes the importance of free will, self-actualization, and personal growth?
So before we jump into those answer choices, let's take a moment to consider what this question is really asking us. It's about understanding those fundamental philosophies behind all these different counseling approaches.
So it's not just about knowing the names of these theories, but actually understanding how they view human nature and their core values.
Precisely. Now let's look at the first option, answer A, psychoanalytic theory.
Psychoanalytic theory, okay. So often connected with Freud, right?
Right.
What is the gist of this approach?
Psychoanalytic theory goes really deep into the unconscious mind. It looks at those hidden drives and early experiences that shape our thoughts and feelings and behaviors. It's really powerful, a powerful lens for understanding the roots of psychological distress. But does it emphasize those things in the question? Free will, self-actualization, personal growth. I'll let you think about that.
Okay, lots to think about there. Answer B, behavioral theory.
This one takes a different approach. It focuses on observable behaviors and those learning processes that shape them. So think about things like classical conditioning, like Pavlov's dogs, or operant conditioning, with rewards and punishments.
So, like a behavioral therapist might focus on changing specific behaviors through things like exposure therapy or reinforcement, right?
Right. It's all about how behaviors are learned and unlearned, and applying those principles to help clients.
So does that sound like the theory that emphasizes free will, self-actualization, and personal growth?
I'll let you mull that over.
Answer C, humanistic theory.
Humanistic theory takes kind of a person-centered approach, focusing on the individual's unique experiences and their drive for growth and self-discovery. So think of figures like Carl Rogers and Abraham Maslow, with their emphasis on things like empathy, unconditional positive regard, and that journey towards self-actualization.
It's about creating a really supportive environment where clients can explore their own feelings and solutions. Seems very empowering.
It is. And think about how that aligns with those concepts of free will, self-actualization, and personal growth.
Okay, last but not least, answer D, cognitive behavioral theory.
This approach, it's often called CBT for short. It emphasizes how interconnected our thoughts, feelings, and behaviors are. So it proposes that our thoughts influence our emotions and actions, and that by changing those unhelpful thinking patterns, we can improve our well-being.
So a CBT therapist might work with a client to challenge their negative thoughts and replace them with more positive or realistic ones. I've heard that can be really effective for things like anxiety and depression.
It can be. CBT is very much about giving clients those practical tools and strategies to manage their thoughts and behaviors.
So does that focus align with the theory that this question's getting at?
I'll let you be the judge.
All right, so to recap, the question asks, which counseling theory emphasizes the importance of free will, self-actualization, and personal growth? And the answer is C, humanistic theory.
Exactly. While other theories have their strengths and different applications, humanistic theory is the one that really champions those core concepts. It's all about empowering people to discover their own potential and create those meaningful lives.
Okay, question 2. Which of the following is not considered a core condition of person-centered therapy?
This is where it gets interesting. Notice that not It's asking you to identify the concept that doesn't quite fit with the principles of person-centered therapy.
Okay, so it's not just about knowing the right concepts. It's about understanding which ones don't belong. Tricky. Can we just have a quick refresher? What is person-centered therapy all about?
It was developed by Carl Rogers, and it places the client right at the center of that therapeutic process. It's about creating a safe and supportive environment where people can really explore their own feelings and find their own solutions.
So it's really about empowering that client
Yeah.
to kind of lead the process. Okay, answer A, empathy.
Empathy in therapy means stepping into your client's shoes,
Right.
right? Really striving to understand their world from their perspective, deeply listening, reflecting their feelings, validating their experiences. It's not about giving advice or solutions. It's about creating that space where they feel heard and understood. Now, would that be essential to person-centered therapy, or would it be something else?
Okay, it makes sense. Answer B, congruence.
So congruence is about the therapist being genuine and authentic in that relationship with the client. It means being transparent and present, aligning your words with your actions, modeling realness and vulnerability, creating that space where the client feels safe to do the same. So how does that concept resonate with those principles of person-centered therapy? That's the key question.
I mean, authenticity is so important in any relationship, really, especially a therapeutic one. All right, answer C, unconditional positive regard.
This is like a cornerstone of person-centered therapy. It's about accepting the client completely, without judgment, regardless of their actions or choices. It's about conveying this deep belief in the client's inherent worth and their capacity for growth. It's not about condoning every behavior. It's about creating that space where the client feels safe to explore themselves fully. Does that align with the core conditions of person-centered therapy? Think about it.
I see how that could be really powerful for a client to feel that level of acceptance. Okay, last one. Answer D, interpretation.
Interpretation usually involves the therapist offering their insights or explanations about the client's experiences. It might be analyzing dreams, connecting past experiences, offering those interpretations of the client's unconscious motivations. So think about how that approach fits, or maybe doesn't fit, with those core values of person-centered therapy.
So it's more about the therapist offering their expert analysis, which kind of contrasts with that client-centered approach. Okay, so let's circle back. The question is, which of the following is not considered a core condition of person-centered therapy? The answer is D, interpretation.
Right. Interpretation can be valuable in some approaches. It's not considered a core condition of person-centered therapy. Person-centered therapy really emphasizes creating the right conditions for the client's self-discovery, not the therapist imposing interpretations.
Question 3. In group counseling, which stage is typically characterized by conflict, power struggles, and resistance? Ooh, group dynamics. This is making me think about all those, team projects back in school.
It's a great parallel, just like any team. Therapy groups go through these predictable stages of development, and this question is asking you to identify the stage where things get a little turbulent.
Where things get a little messy.
Yeah.
Okay, answer A.
So imagine the very beginning, when a group first comes together. Everyone's kind of tentative, sizing each other up, figuring out the ground rules. There's a sense of excitement and anticipation, but also a lot of uncertainty. Does that sound like the stage characterized by all that conflict and those power struggles?
It's like the initial getting to know you phase, right?
Okay.
Answer B, storming.
Now we're getting to the heart of it. Storming is where, that polite veneer cracks. Members assert their opinions, they challenge the leader, they compete for roles and influence, conflict arises, and there might be pushback against the group's purpose or even the process.
So that's where the power struggles and resistance really come into play. It's like everyone's figuring out where they fit in, right?
Exactly. And this tension, even though it's uncomfortable, it's really essential for the group's growth. It's how those members learn to negotiate and communicate and establish healthy boundaries. So storming, is this the stage that the question is pointing to?
Definitely a strong contender. Answer C.
Norming is where the dust kind of settles after the storm. The group has worked through that conflict, established some ground rules, and that sense of cohesion starts to emerge. There's more cooperation, more understanding of the goals, a willingness to work together.
So things are calming down. A sense of teamwork developing. Does that sound like the stage the question is describing?
That's for you to decide. Remember, we're looking for the stage where conflict, power struggles, and resistance are most prominent.
Okay, last one. Answer D. Performing.
This is the stage where the group really hits its stride. There's a sense of trust, open communication, shared purpose. Members are comfortable with their roles. and they work effectively towards their goals.
They've gone through all those trials and tribulations, and they've emerged as this cohesive unit, ready to make progress. Does that sound like a stage characterized by conflict?
Again, I'll let you be the judge. Think back to that question and consider which of these stages really fits the description.
Okay, so to recap, in group counseling, which stage is typically characterized by conflict, power struggles, and resistance? And the answer is B, storming.
You nailed it. And remember, these stages aren't always linear, right? Groups can move back and forth, but understanding this framework helps counselors to guide the process and really navigate all those inevitable challenges.
Question 4. What term refers to the unconscious redirection of feelings from one person to the therapist during counseling? This sounds like it's straight out of a psychology textbook.
It is a key concept for understanding those dynamics of the therapeutic relationship. This question is probing your knowledge of this phenomenon that can significantly impact therapy.
Okay, so answer A, countertransference. Is that what we're talking about here?
Countertransference actually refers to the therapist's own emotional reactions to the client. So it's kind of the flip side of what the question is describing. It's important for therapists to be aware of their own countertransference because it can influence how they see the client and how they interact with the client. But does it describe that redirection of feelings from the client to the therapist? That's the key.
So it's about the therapist's feelings, not the client's. Okay, answer B, projection. How does that fit in?
Projection is a defense mechanism where people attribute their own unacceptable feelings or impulses to other people. It's a way of distancing themselves from those emotions. Like, for example, someone who is angry might accuse others of being angry, projecting their feelings onto them. So projection can definitely play a role in this dynamic. But is it the specific term that we're looking for? It's something to consider.
It's sort of a way of shifting blame or responsibility, right? Okay, what about answer C, transference?
This one's getting closer to the heart of the question. Transference describes that unconscious redirection of feelings from past relationships, often with significant figures like parents or caregivers, onto the therapist.
So the client is bringing their past baggage into the therapy room and playing it out with the therapist.
Exactly. They might react to the therapist as if they were a critical parent or a neglectful partner, even if the therapist hasn't done anything to warrant that. Those feelings are really rooted in the client's past and unconsciously transferred onto the therapy relationship. Does that sound like the term that the question is defining?
It's starting to click for me now.
Right.
Okay, and last option, answer D, repression.
So repression is another defense mechanism where people unconsciously push unwanted thoughts or feelings out of their awareness. It's a way of protecting yourself from painful emotions, but it's not directly related to that redirection of feelings towards the therapist. So think about how that differs from the concept that the question's describing.
It's more about burying feelings than redirecting them outward. Okay, let's go back. What term refers to the unconscious redirection of feelings from one person to the therapist during counseling? And the answer is C, transference.
You got it. Understanding transference is so crucial for therapists because it can provide valuable insights into the client's patterns and their underlying issues. It's not about taking it personally, but using it as a tool for understanding and growth.
It's like the therapist becomes this screen that the client's past experiences are projected onto. This deep dive is really illuminating how much is going on under the surface in therapy.
All right, let's move on to question 5. According to Erik Erikson, what is the primary psychosocial task of adolescence?
Erikson. There are stages of development, right? Trust versus mistrust. I vaguely remember that from Intro to Psych, but it still feels kind of relatable.
You're right to connect it back to your own experience. Erikson's theory says we go through these psychosocial crises throughout life, from infancy to old age. And each stage has this challenge, that if you resolve it successfully, it helps your overall psychological development.
So it's like a roadmap of human development, with all these key milestones along the way.
Exactly. So thinking about adolescence, let's look at the answer choices. Answer A, trust versus mistrust.
Trust versus mistrust. Isn't that more about babies? Like learning to rely on their caregivers?
Right. That first year of life is crucial for developing that sense of trust in the world, but it doesn't really capture the complexities of adolescence, does it?
Different stage of life.
Okay.
Answer B, initiative versus guilt.
This is about young children exploring their independence and testing limits. Think of a preschooler who wants to do everything themselves, pour their own juice, pick their clothes. They're learning to take initiative, but they're also dealing with guilt. When their actions have those unintended consequences.
So finding that balance between independence and responsibility. Interesting how these stages build on each other.
They do. Each stage lays the groundwork for the next one. So how does initiative versus guilt relate to adolescence? Does it seem like the best fit?
I mean, teenagers definitely want independence, but it seems like there's more to it than that.
Let's see. Answer C, identity versus role confusion.
Identity versus role confusion. Okay, this feels more like the teenage experience.
Right.
All those questions about who you are, where you fit in.
You're on the right track. Erikson believed adolescence is a time of intense self-discovery. Teenagers are wrestling with questions like, who am I? What do I believe in? What's my place in the world? They try on different identities, experiment with roles, figuring out what feels authentic to them.
Like they're piecing together a puzzle.
Yeah.
Trying to figure out where they fit in the big picture.
Exactly. And if they navigate this stage well, they come out with a strong sense of self. But if they struggle, they experience role confusion, feeling lost and uncertain about who they are. So, how does this align with the question, the primary task of adolescence?
This one seems like a strong contender. Okay, what about answer D, intimacy versus isolation?
This stage comes a little later, in young adulthood. It's about forming those deep, meaningful connections with other people, both romantically and in friendships. They're looking for intimacy, but they also risk isolation if they have trouble building those relationships.
So moving beyond that self-focus of adolescence and connecting with others on a deeper level. Important, but maybe not the primary task during adolescence itself.
That's for you to decide. Remember, the question's asking about adolescence specifically.
All right, let's recap. According to Erik Erikson, what is the primary psychosocial task of adolescence? The answer is C, identity versus role confusion.
That's right. While other stages matter, Erikson thought forming a solid sense of self was the central challenge of adolescence.
Question 6. Which type of research design involves studying one group of participants over an extended period? Okay, getting into the research side of things now.
It is. And understanding research methods is so important for being an informed counselor. This question wants you to know the difference between approaches to studying behavior over time.
Knowing how researchers gather data and make conclusions. Okay, first option is answer A, cross-sectional.
Imagine taking a snapshot of different groups at one point in time. Like, you might survey teenagers, young adults, and older adults about their views on social media, all at the same time. You get a glimpse of how different age groups see it. But you're not tracking changes over time.
So it's like a slice through different populations at a specific moment.
Exactly. Now, how's that different from answer B, longitudinal?
Longitudinal studies, I've heard about those, especially in developmental psychology.
They're key for understanding change over time. Imagine following the same kids from kindergarten to high school, collecting data on their grades, social skills, well-being, at different points.
So it's like you're filming a movie of their development.
Exactly. Longitudinal studies are powerful, but they're also tough. They take time, they're expensive, you lose participants. But they give us amazing insights into human development. So how does that compare to cross-sectional?
Longitudinal seems more in-depth, capturing that trajectory of change, while cross-sectional is just a snapshot. Okay, what about answer C? Experimental.
Experimental designs are the best for figuring out cause and effect. You manipulate variables in a controlled setting to see how they impact the outcome. Think of a drug trial. One group gets the drug, one gets a placebo. Researchers control things carefully to isolate the effect of that drug.
Creating a very controlled environment to test those hypotheses. Very scientific.
It is. Now, how does that relate to the question about studying one group for a long time?
Right. Experimental designs could use many groups or time frames. So it's not always about one group long term.
Okay.
Last one, answer D. Case study.
Case studies look at one person or a small group in depth. They're often used for rare or complex things. Think of Freud's famous case studies, where he documented his patients' histories and dreams to come up with his theories.
It's like a deep dive into one specific person or situation to understand their experience.
Exactly. They can be full of details, but they don't always apply to bigger groups. So think about how that aligns with the research design in the question.
Okay, to recap, which type of research design involves studying one group of participants over an extended period? And the answer is B, longitudinal.
You got it. Longitudinal studies are key for understanding how we develop and change over time.
Okay, question 7. In career counseling, which theory emphasizes the match between an individual's personality and the work environment? This is something I think about a lot, trying to find work that really aligns with my interests.
It's a question many of us face, and career counseling theories give us frameworks for finding work that's fulfilling.
Like a compass to navigate that career landscape. Okay, let's look at the options. Answer A, Super's developmental theory.
As the name suggests, this one focuses on how career choices change over our lives. It emphasizes the different roles we have: student, worker, parent, retiree, and how our career goals shift as we move through those roles.
So acknowledging that career paths aren't always straight lines.
Yeah,
And change as our priorities change.
right. But does it really focus on that match between personality and work?
Good point. What about answer B, Holland's theory of vocational choice?
This theory is all about finding that fit between who you are and the work you do. Holland said people are happier and more successful when their careers match their interests.
Like finding the perfect puzzle piece that fits your unique shape.
Great analogy. Holland had 6 personality types: realistic, investigative, artistic, social, enterprising, and conventional, each with a matching work environment. Like, someone who's realistic might like construction or engineering, while someone social might love counseling or teaching.
So understanding your personality
Yeah.
and finding a career that uses your strengths. This theory is really speaking to me.
It's a popular theory, used in career assessments and counseling. Now, how does it compare to the other choices, especially about personality and work environment?
Okay, answer C, Krumbolz's social learning theory.
This theory highlights learning experiences and chance encounters, shaping your career path. It says our choices are influenced by things like exposure to different jobs, role models, even random events.
So sometimes our careers are less about our choices and more about the opportunities that come our way.
Exactly. But is personality and work environment the main focus?
Okay, last one is answer D, Ginsburg's theory.
This explores those developmental stages of making career decisions, from childhood to adulthood. It focuses on fantasy, tentative choices, realistic exploration, and shaping those career dreams.
Our goals change as we mature and understand ourselves and the working world better.
Exactly. But does it highlight personality and work environment as the key to career satisfaction?
Okay, let's recap. In career counseling, which theory emphasizes the match between an individual's personality and the work environment? The answer is B, Holland's theory of vocational choice.
That's the one. It's used a lot to help people find careers that align with who they are.
Question 8. Which ethical principle requires counselors to respect the autonomy of their clients? Ethics are so important in helping professions.
They are the foundation. They guide our actions and ensure we're always acting in the best interests of our clients. This question looks at one of the most important ethical principles.
Okay, first option is answer A, beneficence.
Beneficence means doing good for your client, promoting their well-being, working towards their best interests, using our skills to help them reach their goals, and live fulfilling lives. It's a cornerstone of what we do.
So actively working towards their benefit, using our expertise to guide them.
Exactly. But does this principle specifically say we have to respect their autonomy?
Right, it's about doing good for them, but it doesn't necessarily mean they make all the decisions. Okay, what about answer B, non-maleficence?
This basically means do no harm. It's about avoiding actions that could hurt the client, physically or emotionally, being aware of the risks of what we do, and trying to minimize any bad consequences.
Being cautious and responsible, making sure our actions don't have unintended negative impacts.
Exactly. But does it directly address respecting their autonomy?
Right, it's about preventing harm, but it doesn't guarantee their right to choose. Okay, how about answer C, justice?
Justice means treating all clients fairly, making sure they can access services and resources no matter their background. It's about advocating for social justice and challenging the systemic barriers to care.
So fairness and equality.
Yeah.
Everyone having equal opportunity to benefit.
Precisely. It's vital, but does it specifically address autonomy?
It's about fairness in the system, not necessarily individual choice in therapy. Okay, last option is answer D, respect for autonomy.
This is all about the client's right to self-determination, honoring their values, beliefs, and goals, even if they're different from our own, giving them the info to make informed decisions about their lives and their therapy.
Empowering them to make their own choices, recognizing they're in charge of their lives.
Exactly. Respecting their agency and partnering with them in therapy. How does this align with the question?
This seems like the most direct answer. It's specifically about honoring their right to choose.
So the question is, which ethical principle requires counselors to respect the autonomy of their clients? And the answer is D, respect for autonomy.
Okay, on to question 9. What statistical measure is used to describe the degree of relationship between two variables? Statistics can be a bit intimidating, but I know they're important for understanding research and how well different interventions work.
They are. Statistics help us make sense of data, draw conclusions, and base our work on evidence. This question is about a fundamental statistical concept.
Okay, let's see if we can make this easier to understand. Answer A, mean.
The mean is just the average. Add up all the values and divide by how many there are. It gives you a sense of the center of the data.
Okay, that's basic math, but how does that relate to two variables?
The mean itself doesn't tell us that. It just describes one variable. Keep that in mind as we go through the others.
Got it. It describes one set of data, not how two sets relate. All right, how about answer B, standard deviation?
Standard deviation tells you how spread out the data is around that mean. Big deviation means the data's all over the place. Small deviation means they're clustered close to the mean.
A measure of variability, right?
Exactly. But like the mean, standard deviation only describes one variable. It doesn't directly tell us about the relationship between two.
Okay, so we need something that shows the connection between two variables. What about answer C, correlation coefficient?
Now we're getting closer. This measures how strong and what direction the relationship goes between two variables. It goes from -1 to +1. Positive correlation means as one variable goes up, so does the other, like height and weight. Negative correlation means as one goes up, the other goes down, like sleep and fatigue.
So it's showing us how closely two things are related, and if they move together or in opposite directions.
Exactly. The correlation coefficient gives us a number. That shows how strong and what direction the relationship is. Does this sound like what the question's describing?
It seems like it. It's capturing that relationship between two variables. Okay, last one is answer D, variance.
Variance measures how much the data points differ from the mean. It's like standard deviation. Standard deviation is just the square root of variance, but variance, like standard deviation, describes one variable.
So it shows us the spread, but not the relationship between two variables.
Right. The question's asking about that relationship between two variables.
Okay, I'm seeing the difference now. Let's recap. What statistical measure is used to describe the degree of relationship between two variables? The answer is C, correlation coefficient.
You got it. It's a valuable tool, but remember, correlation isn't causation. Just because two things are correlated doesn't mean one causes the other. There could be other things at play.
Right, correlation does not equal causation. Okay, question 10. Which of the following is a technique commonly used in solution-focused brief therapy, SFDT? That sounds like a very particular kind of therapy.
It is. Solution-focused brief therapy is goal-oriented. It emphasizes finding solutions. Instead of dwelling on problems, it focuses on what the client wants to achieve, rather than the past.
So it's about looking ahead and figuring out how to get to a better future. I like that.
It's a popular approach, known for being practical and effective. Now let's see which of these techniques fits with SFBT. Answer A, empty chair.
Empty chair.
This is often used in Gestalt therapy. The client imagines someone or part of themselves sitting in an empty chair, and they talk to them. It's a good way to explore perspectives, work through conflicts, and practice being assertive. But is it a key part of solution-focused brief therapy?
So bringing those different voices into the room, even if they're not physically there. Interesting, but maybe not specifically SFBT.
Let's see. Answer B, dream analysis.
Dream analysis.
This is important in psychoanalysis. The therapist helps the client figure out the meaning of their dreams, to understand their unconscious thoughts and feelings. It's interesting, but does it fit with SFBT, which focuses on solutions and the future?
So going deep into the unconscious, to understand those hidden meanings. Interesting, but maybe not practical or solution-focused.
Answer C, miracle question.
Miracle question.
Now, this is a classic SFBT technique. The therapist asks the client to imagine a miracle happened overnight, and their problem was solved. The client describes what would be different, highlighting what they want, and possible solutions.
Wow, that really shifts the focus. From problems to possibilities, it's like you're helping them imagine a better future.
Exactly. The miracle question helps them see their goals, recognize their strengths, and start thinking about steps to create that change. How does that fit with SFBT?
It seems like a perfect fit. Okay, last one is answer D, systematic desensitization.
This is a behavioral therapy technique, mostly for phobias and anxiety. You gradually expose the client to what they're afraid of, while teaching them to relax. It's structured and step-by-step, to overcome fear.
Slowly getting them used to what they're afraid of.
Exactly. But does it fit with the ideas of SFBT?
Okay, I see the difference. Which of the following is a technique commonly used in solution-focused brief therapy, SFBT? The answer is C, miracle question.
You got it. It's powerful for helping clients see a future without their problem and figure out how to get there. Feeling, isn't it? We've really dug into these concepts and started to get those core principles that'll help you not just on the exam, but in in how you approach being a counselor.
For sure. It's not just memorization, it's really understanding the field. So what are some key takeaways from Module 1?
Well, we started with those different counseling theories, right? Psychoanalytic, behavioral, humanistic, cognitive behavioral. Each one has its own way of looking at how people behave and change. Knowing these theories is super important for having a well-rounded view of counseling.
Like having different tools in your toolbox, right? You wouldn't use a hammer for every job.
Exactly. Then we looked at group dynamics. Remember those stages groups go through? Forming, storming, norming, performing. Knowing these helps counselors to see challenges ahead of time, deal with conflict, and help the group come together.
Even that storming stage,
Yeah,
with all the conflict, is normal, which is good to know.
it is. And then we got into that therapeutic relationship, specifically transference, where clients kind of put feelings from the past onto the therapist.
That was eye-opening for me. It shows how therapists need to be aware of their own reactions and use transference to understand the client better.
Absolutely. We talked about ethical principles too, especially respecting the client's autonomy, helping them make their own choices. That's essential to being ethical.
Honoring their right to decide and having that collaboration, where their voice is really heard.
We also touched on research methods, like cross-sectional versus longitudinal studies, understanding how research gives us knowledge. Being evidence-based means staying up to date on research and using it to guide your work.
Right, research is the basis for making good decisions.
And finally, those counseling techniques, like the miracle question in solution-focused therapy. It's all about shifting from problems to solutions, helping people see a brighter future.
It reminds me that even when things are tough, there's always hope and a chance for things to get better.
Exactly. And remember, this is just the start. We've got 19 more modules to go, covering lots of stuff you need for the NCE.
I feel ready for the next one. Any last advice for people getting ready for the NCE?
As you study, remember, it's not just about passing a test. It's about becoming a good counselor, an ethical one. So keep learning, stay curious, never stop wanting to know more.
Well said. To all our listeners studying for the NCE, we're here to support you. We'll see you in the next deep dive as we keep exploring the world of counseling.
Until then, keep those concepts in mind. And don't underestimate a good study session.
2, 3.
Nice to be in orbit.